Heart valve disease is a condition in which one or more of your heart valves don't work properly, often with the person not experiencing any symptoms for years. We spoke with Dr. Douglas Zussman at Hoag Memorial Hospital Presbyterian in Newport Beach to find out more.
And there are three symptoms related to aortic valve disease. For aortic stenosis, where there's a blockage of the aortic valve, which occurs in the 50s, 60s, 70s, 80s, and even ninth decade, are lightheadedness, shortness of breath, and chest pain. Even without coronary disease, people who have aortic stenosis can complain of chest discomfort or chest pressure. When the left ventricle fails, blood will back up through the mitral valve into the lungs, and people will complain of shortness of breath. And when the valve is too tight, there's not enough blood going to the brain, and people will complain of lightheadedness or even true syncope where they pass out.
And we asked Dr. Zussman, what's the difference between repair and replacement?
The difference between repair and replacement, usually repair is referred to two other valves of the heart called the mitral valve and the tricuspid valve. What we do is we try to repair or keep the tissue of the valve intact by repairing it with new cords or new tissue or a ring around the area that's causing the leakage to constrict it and prevent leakage through those valves. For aortic valve, although techniques have been used to repair the valve, it tends to be very difficult to do that for the long-term course. So we usually replace it. And there are two types of valves that I discuss with the patients. There's either a mechanical valve made out of metal, or there's a non-mechanical made out of cow or pig. And if someone is older, in their 60s, 70s, the non-mechanical valve, usually at 15 to 18 years, will still be present or functional in 90% of the time. So it should last the entire duration of their life. If someone's in their 40s or 50s, you would put in a mechanical valve because you want that valve to last into their 80s. And those valves have a longer longevity.
Dr. Zussman told us about the recovery time after this procedure.
In general, they are followed, seen by the physician with 1 week. The sutures are removed at about that time. They're usually in the hospital for less than a week duration, and as long as they don't develop any rhythm problems, wound problems, renal problems. And then they're followed up with yearly echocardiograms to make sure that the valve is functioning fine and there's no leakage or obstruction or rhythm problems. For 3 months, they tend to be on Coumadin, which is a blood thinner. And the reason for that, we want the sewing ring of the valve to endothelialize. And what endothelialize means is that the native inner lining of the aorta will cover the sewing ring so clots don't form, so they don't have a stroke. The median age of valve replacements are probably in the 70, 75 age range. And the interesting thing is we've done a great deal of octogenarians and people in their 9th decade and have operated on them with excellent success. They may be in the hospital a little bit longer, but they still succeed, and we've had excellent statistics, greater than close to 100% success rate in the 9th decade on those individuals, and very high success rate even in the 8th decade.
Dr. Zussman discusses the success rate for the procedure.
Well, you have to look at the comorbidities, the other risk factors associated with individuals. Have they had stroke? Do they have diabetes? Do they have chronic obstructive pulmonary disease? Do they have renal failure? Those would put them at higher risk. So if you don't have those or significant risk factors associated with it, the chances of surviving the procedure are greater than 98, 99%.